Hello there, welcome to another program of Health Matters, a presentation by the Ministry of Health. Glad that you could be with us in our program. We're talking about, once again, COVID vaccines, and this time for children. I've got with me Dr. Mallika Mootoo and Nurse Shimeca Henry. Welcome to our program.
Thank you.
We would have gone through this a number of times on live programs and programs such as this. Dr. Mootoo, I can start off with you. Give us a bit of background into vaccines globally, worldwide, and as it relates to Guyana.
Okay. Thank you, first of all, Nazim, for having me on the show. It's always a pleasure to be here. So the history of vaccines. So interestingly enough, vaccines have been around for a very long time, and just the whole concept of vaccines have been around for a very long time. In the 16th century, when smallpox was raging in all parts of the world, the Chinese actually started trying to see if they could take the scabs of smallpox, grind it up, make a powder, stuff it into a pipe and put it into your nostrils, and that's something called insufflation. That was a type of trying to protect you against an infectious disease. The person who actually first made the first steps towards vaccination was a doctor called Dr. Edward Jenner. And I'm sure a lot of people know the story. It was again around the time during smallpox. He noticed that milkmaids, young ladies that milked cows, contracted something called cowpox. And those people did not get smallpox. So he then took some of the pus from a cowpox sore and vaccinated it into people to try to protect them against smallpox. And it worked. And that is actually how the word vaccination came into being, because it came from the Latin word vacca, which means cow. A century later, Louis Pasteur did something similar with rabies. A child was bitten by a rabid dog, and he took a weakened rabies virus and injected it every day for 13 days into this child. And the child did not contract rabies. And that kind of was the beginning of it all, I would say. So over the years, people have made vaccines from live viruses, weakened viruses, killed viruses. And with those vaccines, we have been able to vaccinate people from the mid-19th century and protect them from a variety of infectious diseases. So diphtheria, whooping cough, tetanus, mumps, measles, rubella, just to name a few, Haemophilus influenzae, all the way down to now COVID-19 vaccine. So the concept of vaccinating someone, of protecting them against an infectious disease, is not a new concept.
And then the culture of vaccines, for those people who have to travel to some countries, you're told if you have to go to particular countries, you have to get vaccine. And sometimes we want to go, so we just turn up, pay our money, and we don't know what we're getting, but the thing is, we want to go. So there is a culture of people accepting vaccines.
There is. I mean, the yellow fever, that's a really great example, because the yellow fever vaccine is one of those vaccines. So we can't enter certain countries unless we show that we've been vaccinated against yellow fever. Can't enter Jamaica. We can't enter Malaysia without showing that we've been vaccinated against yellow fever.
Even next door, Brazil.
At one time, Suriname was asking for our yellow fever vaccination cards.
Yeah, people just turned up. And even people who had to go to the Middle East for religious obligations, so they have to have vaccines. Guyana's history with vaccines, when you think we would have started, and especially we know vaccines as relates to children going to school. It's a prerequisite.
So in the expanded program of immunization is a program with the World Health Organization, Pan American Health Organization, and UNICEF being a partner, major partner. Guyana signed on to that program in the early 1970s, where they were trying to eradicate 6 vaccine-preventable disease, namely the ones that doctor called before: measles, mumps, tetanus, diphtheria. And as of today, we have at least 17 antigens that we are vaccinating against these diseases, including the COVID-19 vaccine now, which would be added to that.
Right, so that's just a background as to vaccines globally and in Guyana. What we'll do, we'll take a break, and when we come back, we'll have more for you on Health Matters.
There is a disease out there called COVID-19, so you must remember to wear a face mask. If children wear a mask, we are also helping to stop the disease from spreading to our parents and grandparents, or brothers, sisters, and our friends. We must always wash our hands for 20 seconds using clean water or hand sanitizer before and after wearing the mask. If we touch our mask, we must wash our hands or use an alcohol-based hand sanitizer for at least 20 seconds. Wear a mask that fits your face and covers the mouth, nose, and chin. Do not wear your mask on the forehead or under your chin. Always store your mask in a clean bag after use.
Parents, if your child is 2 years or older, ensure they wear a face mask in public correctly. Remind your child that sharing masks is a no-no. That way, they have fun with their friends and they're safe.
Glad that you're still with us on Health Matters, and Nurse Henry. Walk us through your first, if you can remember how far back, your first administering a vaccine. Tell us about that experience.
So, coming from a hospital setting where you give injections to adult patients, to the public health setting where you give vaccines to babies or children below the age of 5 years old, I was quite nervous. By constantly giving or asking the parent, "Oh, mommy, please position the child with your leg over the child to comfort this child so that I can give the vaccine." Sometimes I was even nervous than the parent to give the vaccine, but over a period of time, you become comfortable. The parent as well, once you explain the procedure to them, "Oh, mommy, I'm going to give this vaccine today. Baby will come back to clinic on the next 2 months," and they become comfortable. Also, that helps you to build your confidence in giving the vaccine.
Interesting. You use the word injection, vaccine. What's the difference, Dr. Mootoo?
So, a vaccine is an injectable something. So an injection is actually when you give something through a needle, either under the skin, in between the layers of the skin, into the subcutaneous tissue, or into the muscle. It's an injection medication can be given in various forms, and an injectable form is one of them. So a vaccine is a type of injection. We do inject it into the children, but it's termed vaccinations. Whereas when we give injections, when we give medications, we just call those injections.
And interestingly, those of us, the layman, once we see that needle, it's either most likely going 1 or 2 places on your arm or on your rear. Why, in the case of certain vaccines, there's the arm and then there's the rear? What's the difference?
So for the children up to the age of 1, we give the vaccines in their thighs, in the outer part of their upper thigh, and that's mainly because of the muscle mass. So a small baby has a larger muscle mass in the thighs than in the arms. Once they're older, we give them their vaccines in their arms. We also give injections, whether we're giving intramuscular injections, we also give them to the babies in their thighs. The only vaccine that we give to babies in their arms is the BCG vaccine, but that does not go into the muscle. That is intradermal vaccine.
So we now in this most historic moment of COVID-19, and it came upon us so quickly. And vaccines were developed. We started with adults, and now we've got clearance to give children. First it was adolescents, and now we're going to give children. Why is it important for parents? And they will ask, well, why my child must get a vaccine? And I can start with you, Doc, and then to Nurse Henry.
So, good question again, Nazim, because indeed a lot of parents are asking that question. Why do I need to get my child vaccinated? Isn't COVID almost over? So first of all, I don't think COVID is almost over. And I think that the reason why it is important to have your children vaccinated is, one, we do know that children do get COVID. Even very small children get COVID. We do know that the majority of the time, the children do not get very sick. They have a milder disease. But we also know that there are children who get very sick, and there are children who actually die from COVID. We don't know which child will be that one that gets very sick and which child won't. So I think it is safer, in the best interest of your child, to protect your child against COVID. Now that we're vaccinating younger children, we still have a small portion of children under the age of 5 who still can't be vaccinated. So by you having your child of 5 years and over vaccinated, you're also still protecting the younger children who can't be vaccinated.
What was my experience in giving children the vaccine, Ms. Nurse Henry?
Pardon?
Experience with giving the vaccines to children.
Okay. First, they would be scared. If we don't explain to them, well, okay, you're here today at clinic, I'm going to give you your vaccines today. Some children would, by constantly coming to clinic, they will know, oh, today's vaccine day. So they will be comfortable in receiving the vaccine. Some children may not be comfortable, so you might got to say, oh, after the vaccine, mommy's going to take you out or so, and then they would become comfortable and accept.
And if you can explain the procedure or how this will work when parents bring in their children.
Okay. So the Ministry of Education, in collaboration with the Ministry of Health, is rolling out the 5 to 11 Pfizer vaccine for children. So they're asking that the parents walk with the child health card, which is the small take-home card. So when they get to the vaccination site, they will be greeted by a healthcare worker who will then ask some questions on a checklist. So these questions, the parent will be asked about the child health, if the child is okay today. There are some other questions there. At the end of the checklist, there is a part for a consent to be signed by the parent or guardian who's accompanied the child. After the checklist is filled, the child will be taken to the vaccination room where the nurse administering the vaccine would explain the procedure to the guardian or parent. After the child is vaccinated, they will be given a second date, a date to come for the second dose. Each child will be observed for at least 15 to 30 minutes in the observation area. This observation is to observe them for any reaction to the vaccine. If there is no reaction, the child can proceed home in the care of the parent.
As in the adult, the booster will come into effect for these children also?
As it is presently, the vaccine was approved only for our children who are immunocompromised, who are considered immunocompromised for a booster dose. But for healthy children, they are approved 2 doses, which is the first and the second dose, 8 weeks apart.
Dr. Mootoo, you've been in this business for a good while, and now with COVID, you must be getting feedback from parents and other members of the society as it relates to vaccines, especially giving children vaccines. What are some of the buzz you are getting?
So I think it's twofold. I think similarly to what we experienced with the adolescents, we have some parents that are eager for their children to be vaccinated because they want them to go back out to school, to be safe at school. Even though kids are back in school, I think some parents feel a little apprehensive. Every time the child gets a cough or a cold, is this COVID? So there's some parents who are happy to do it, and there are some parents who have some misgivings, some nervousness. They're not sure if they should be giving the children the vaccines. I think one of the things that really helps is that we have a culture of vaccinating children, and that all of our children have to be vaccinated to enter schools. So I think that is helping us a lot, that we're able to speak with our patients, parents, and explain to them that, you've brought your child all the time for vaccines. We've given your children vaccines. And you've seen that they've remained healthy. They may have had some side effects, but they've remained healthy. I think that is helping to soothe some of the nerves. And, people are asking questions, and we're always happy to answer questions.
What would be, we know in the adult campaign, we have seen some signs and symptoms, some after effects, immediately sometimes after the vaccine. That is why we've got that 15, 20 minutes period observation. What is the literature telling us about children?
So very similar to what we heard before, and the nurse very clearly explained to us the procedure. So that waiting period afterwards is just in case anyone has a severe allergic reaction to any component of the vaccine. If they do, there would be everything on site to take care of that. But apart from that, we are with the younger children, the children less than 12 years old, we're seeing mainly localized reactions. So that would be some soreness at the site of the vaccine, maybe some muscle pain, maybe some fever, just a feeling of lethargy, a feeling of malaise. And most of the time, this is happening not on the day of the vaccine, but maybe on day 1 or day 2 of the vaccine, after the vaccine.
Doctor, we were talking about something just before we came on camera, and we've got just under 2 minutes. And you mentioned we don't have the culture of medical checkups. Do you think, as a result of COVID, the time is right now for us to sensitize the population that you need to have a medical checkup, even from children now, going right up?
So yes, we were talking about that. So with the children, it's a little different because up to the age of 5, parents bring their children to clinic. So we see them very regularly in the beginning, and then we see them, less regularly up until they're 5 years old. Then we do have a gap when they don't come that regularly. We would try to encourage parents to bring their children at least every year for an annual checkup. Not just children. I think it's important for everyone to be aware of what's going on with them and with their bodies. And every year, check for the basic things. Hypertension, diabetes, breast cancer screening, cervical cancer, prostate cancer. Those are things that I think older people especially should do, but younger people should get into the habit of going to the doctor just for checkups, well checks.
Right. So we'll take another break, and when we come back, we'll have just the ending part and to wrap up on our program of Health Matters. Don't go away, we'll be right back.
My name is Akila Idol. I have received both doses of the Pfizer vaccine, and I have not experienced any side effects. And today I am living a healthy and safe teenage life. COVID-19 vaccines help both adults and children from getting seriously ill, even if they do get COVID-19. Everyone, please continue to stay safe and well.
My name is Mallika. I have received both doses of the COVID-19 vaccine. Today I am fully vaccinated. I am healthy and living my normal life in a safe manner.
Welcome back to our program, Health Matters, and we're talking COVID-19 vaccines for children between the ages of 5 to 11. That's the age group. And I've got, if you just joined us, Dr. Mallika Mootoo and Nurse Shimeca Henry. So, Nurse, you've got some hard work ahead, no doubt, with the children 5 to 11, and of course your colleagues. Tell us what's been happening since we knew that this age group are about to be vaccinated. What's been happening?
So since the Ministry of Health heard that the 5 to 11 vaccine was approved for children, we have started the training for the healthcare workers. So in February, we hosted the training for the command nurses who were responsible for the training, sensitization, and supervision of the healthcare workers across the region. From February to March until May, we've completed training for all the healthcare workers directly attached to the COVID-19 vaccination team in all 10 administrative regions in Guyana.
And this vaccine for this particular age group will be available once it started countrywide.
Yes, as announced by the Honorable Minister Anthony a few days ago, the vaccine is expected to be here shortly.
Right. So once, and how people would know, I mean, through this particular program, how people would be aware of dates and times and places.
Okay. So the Ministry of Health has started their public awareness on their website, as on their page, as well as the healthcare workers who are trained. The aim of the training was for them to go back to their community and educate the Guyanese public at the facility that they seek care.
Dr. Mootoo, we're seeing, as the year started, we have seen, an ease and some lifting of restrictions. But now that dashboard that came up is now coming back and so forth. Do you think it is still important that whilst we are, pushing vaccines, the other protocols and guidelines that we had before, with the mask and sanitizing, we should still continue and impress on people, and our children also in school, to adhere to this?
Yes, I too have been watching the dashboard and have seen that there has been a rise, which I think is to be expected when we lift restrictions, when we allow people to go out and mingle. I think the Minister of Health did ask us to start thinking again about keeping all of those protocols. I think as we see cases rising, I think we definitely should think twice about, do I have a mask in my bag when I'm going out? Wearing masks, sanitizing, yes, but also keeping that distance between us and the person in front of us in the supermarket line or, wherever we are. I think many times when I go out, I notice that we've kind of lapsed on that one as a public. But I definitely think, I agree with you 100%. I think, yes, we're doing our best by vaccinating everyone, but we should keep those protocols in place for now.
No, sorry, these are not normal times that you're at your hospital or your clinic and you wait for the babies to come and be vaccinated, and now the patient now and then to come. For the past few months since the arrival of the COVID-19 vaccines, health workers have been working beyond the call of duty. How taxing it is on these nurses and these medics who are given the vaccine.
Many nights we're up late in the night, early in the morning. It has been very taxing for the healthcare workers, but for some reasons we are strong Guyanese and we were able to pull through.
Right. And so you're all prepared for when that vaccine, this vaccine, the Pfizer vaccine, ready for the nationwide outreach?
As it is now, we are prepared. Yeah.
Okay. On our program this evening, today we had Dr. Mallika Mootoo and Nurse Shimeca Henry. We've been talking about the readiness and all preparations in place to rule out COVID-19 vaccines for youngsters aged 5 to 11, that age group. Parents, you are encouraged to look at your media, social media, and newspapers and television for when the rollout of the vaccines will be in your area. I'm Nazim Hussain. Thank you for watching. Do join us again next time. Until that time, be safe.